Now we will look at some other forms of institutional discourse. We have discussed therapeutic discourse, and now we will look at institutional discourse, which are there in multiple forms. Institutional discourse is different from everyday communication or everyday discourse that one has, which is a normal, regular discourse. It is different in terms of the situations. It has predetermined topics of conversation and highly conventionalized linguistic features. The role of the interlocutors in this type of discourse is also situational based. Now, institutional discourse has two approaches. One is descriptive and the other is critical. Descriptive approach has two elements. One is the observation of language that is being used, and also the analysis of the semantic aspect of discourse or semantic aspect of institutional communication. The critical aspect of institutional discourse looks at the critical analysis of the social inequality that is being expressed through language and the discourse both. So, as I have mentioned that it is different from everyday, it takes into account the discourse that is there when we are looking at how judges talk, how physicians talk, and other specialized areas in which the specialized discourse takes place. So let's discuss some of the features of institutional discourse. Most institutional settings identify a particular individual, therapist, judge, academic advisor, physician, and so on, as the authority or authoritative figure. In addition, we have seen that although psychotherapists are authority figures, they are careful in the ways that they exercise their authority. Judges, by contrast, are not as timid, or they do not have to be so particular about this particular aspect. In a court of law, there are more clearly prescribed patterns of allowable questions and answers, and most judges do not hesitate to control their courtrooms when matters tend to get out of hand. It is not uncommon to hear judges, for example, tell attorneys who have strayed or who have deviated from their discussion on a given topic to just end the discussion, and they do it in a very authoritative manner. Physicians probably occupy an intermediate position on a continuum of how strictly or loosely institutional authority is wielded. Like therapists, physicians require data from the patient to be of much help, and good physicians listen carefully to their patients' symptoms and concerns. So they do not do things in a haste manner or abruptly, because they require to be patient in order to elicit as much information as possible from their patients. Also, like therapists, physicians reserve the role of interpreting these symptoms, often with the aid of various diagnostic tests. Once the test results are final, the physician interprets their significance to the patient and recommends a particular course of actions or outlines the alternative possible actions. As Heath has observed, the diagnosis is a pivotal point in the consultation behavior between patient and physician. It is important to have the process of data gathering so that a proper prescription is prepared. Physicians tend to distribute more of their time on identifying symptoms and recommending treatment than on discussing the diagnostic features. According to Byron and Long, They conducted a study and found that physicians often moved quickly from conducting a physical examination to detailing a course of treatment without much discussion of why they had made a particular diagnosis. Now, this can sometimes make the patient frustrated or restless in terms of who strives to look into or strives to have a more clear understanding of the problem or a health issue that he or she is facing and how he or she can recover. More generally, it appears that institutional talk draws on principles of conversational behavior that are used in everyday speech, such as taking turns and negotiating end of encounters. Thus, to speak effectively in institutional settings, one must master not only the rules that are mentioned above or we have just discussed, but also rules that are specific to particular conversational setting. Institutional discourse, although it may resemble ordinary conversation, incorporates specialized rules of discourse. Thus, to speak effectively in institutional discourse, one must master not only the general rules, but the specific rules which are particular or specific to these conversational settings.